teach medical students clinically, and I always say to them, you have to love what you do in the day-to-day.
Hello everyone, I'm Glenn Faison, the Alumni Engagement Director here at Touro University, California, and I'd like to welcome you to the latest episode of The Current, our alumni podcast here on campus. Joining us today is Dr. Mary Afsari. She's a DO from the class of 2006 here on campus. She did a residency with the University of Connecticut School of Medicine, specializing in obstetrics and gynecology, and received your master's from Tufts University Emerson College in health communications. Is that correct?
Yeah, that's right.
Okay, great. So thank you for joining us on the podcast. I do want to let you all know that Dr. Afsari is also a published author. This is her book, Labor, One Woman's Work. And you ready to get started?
Yes, it's so nice to be here, and it's really fun to be on campus.
When's the last time you were on campus?
I honestly don't think I've been here since graduation in a real context, so it's been 20 years.
Well, great. Well, we're gonna show you around later on a tour of campus, so hopefully you like what you see. So your family is from Iran. You were born here in the U.S., but your family's from Iran, and as I understand it, your family went back there briefly and then came back. Can you describe that whole process for us?
Yes, my dad was sort of a recruit from the University of Shiraz back in the 1970s. He was a medical student, and at that time, the U.S. and Iran had a real working relationship between scientists and doctors, and so there were visiting professors coming from universities like Johns Hopkins and actually doing year professorships in Iran. So it was a really nice relationship, and he was recognized as being like a very high, quality student, and he got recruited to actually go to Johns Hopkins to complete his internal medicine residency. So he and my mother went to, Baltimore at the time, and in the interim, they had my brother and I, so I have an older brother, and I were born between Baltimore and Chicago, where he completed his fellowship in infectious disease. And the plan had always been to take the family back to Iran. There was not really the intention at that time to stay here permanently, and so we moved back. I was about 18 months old. It was nice for me and my brother because it's when language develops, and so we actually absorbed the language of Farsi, and as a result, we both can understand and speak Farsi today in a way I don't think we would have been able to. And back then, in around 1977, 78, there were the rumblings that there was going to be some sort of a revolution. And at that time, thousands of Iranians did leave the country. And my parents made the decision to return back to the United States. That's how we ended up back here. And they thought that Chicago was a little too cold. And they packed us up in a car and drove across the country and ended up in California.
Oh, great. So you grew up in California.
I did. I'm a Bay Area kid.
All right. And where'd you do undergrad?
So I went to UC Davis.
Oh, great.
So not too far.
Yeah.
So I was about an hour from home for those first 4 years.
Okay. And what was your degree?
So I did know that I was going to do pre-med at the time, even though I was sort of an undecided pre-med candidate and student, but Davis is really known for pre-med studies and their sciences, and so I did complete the requirements, but I ended up majoring in psychology.
Okay.
And did a lot of classes in creative writing and women's studies, which is sort of also where my heart lies.
Okay. Well, the creative writing helped you when you went into your health communication master's degree then.
Yeah, when I graduated from Davis, I still was unsure about what path I was going to take. I just don't think I was ready to commit to what we know medical school requires, not just school itself, but the career. So once you start the path, you've sort of determined what your life is probably going to look like as far as a career goes. So I found it was a very young program. It was a master's in health communications. And I loved that it had a public health component at Tufts University, but it incorporated writing and communication studies at Emerson, which is also known for that. And so I did not know where Boston, Massachusetts was on a map. And after college, I ended up just applying at the end of my senior year, and I got accepted and I moved across the country. And then that started sort of an East Coast stint for me of about a dozen years.
Okay. And ultimately, you did decide to come into medicine. Obviously, you chose to become a DO.
Yeah.
Why Touro? What brought you back? Was it just to come back home? Was that part of the driving force?
I mean, it was part of it. I definitely started thinking about medical school probably 4 to 5 years into doing nonprofit work in Boston. I was working in health research. I was doing focus groups. It was really interesting work. It was patient-centered. We were trying to learn from patients themselves how we could redesign facilities, which is kind of ironic considering where I am today, and well, I know we'll get to that. But I started thinking about medical school, and I have such a holistic approach to medical care and medicine in general and what wellness is and what health is, that I early on decided I was only going to apply to DO schools. And then at that time, this campus had just opened. We were the 5th class. And so knowing that there was an opportunity to come back home after being on the East Coast for 8 years and that the school was here, it was my first choice, was to come back here.
Well, great.
Yeah.
Obviously, we're thrilled that you did. Why don't you share some of your most fond memories of your time here at Touro? I mean, at that point, 5 years in, I've heard from folks in the early years how the students were helping to craft the program and build the program and make the program better for the students that come behind them. Was that still happening when you were here?
Oh, yeah. I mean, we were such a fun class. And I mean, just yesterday I was on a hike with one of my best friends who I made during orientation week. And just last week I was with another one of my best friends from here. So the friendships, and I know that people will speak to that, probably every class that has come through. It was such this campus is so unique in the sense that we're not in the middle of a city, and we weren't super established at that point. And so I think when you bring young people together in sort of an eccentric situation, people are going to come together and bond and sort of make it work. I mean, that time, and I'm not familiar with the student housing right now, but I had a lot of friends that lived in the barracks on campus, and then some of us lived in town. But we were starting a lot of clubs. There were a lot of clubs that hadn't started yet. And so a lot of the specialty clubs might have started with my class or just before my class.
Okay.
I was a part of campus beautification, where we decided that we just needed to plant some flowers and get some, color out in front of the new Landers Hall and the buildings that are out front that had been built. And so we did a big gardening project one of the springs that I was here. And yeah, the friends that I made came from different walks of life. Some of us had spent 5 or 6 years out of school, so we were maybe slightly older than some of the other incoming kids. I met most of my good friends during the first few days of orientation, and I don't know if they do this now, but every single one of us went up on stage and introduced ourselves during that student orientation. I think there was about 125 of us.
Yeah.
So it was a real way to get to know people's personalities. One of my good friends had also been a yoga instructor, and she did her orientation in a headstand. And so I remember her getting up on stage and getting into a headstand and introducing herself. And she started a yoga club on campus, and we met every week. So a lot of extracurricular activities, getting out and rock climbing and running and swimming and going up to Lake Tahoe and snowboarding and skiing when we could. We took flashcards with us everywhere. And I have memories with my friends of quizzing ourselves on the drive up to Lake Tahoe. We sometimes went camping in Yosemite with our flashcards before our exam weeks. And so incredible memories of trying to build community while also being really, really serious about our schoolwork.
Yeah. So when did you decide on OB-GYN?
I was really fortunate because I was a little bit antsy in my second year here as a student, and I felt like I wanted to see if I could do a little bit of clinical work, even though we really don't do much of that in the first 2 years. And it was Dr. Hartwig at that time, who's still here today, who tipped me off that there was a scholarship program that was for medical students where you could do 1 month abroad. And there were different countries that you could select from. And if you got the scholarship, it was fully funded. And so some of the countries, there was India, there was Bolivia, there was Mexico, And because he knew that I was sort of interested in that, he helped guide me, and I applied for that 1 month scholarship, and I got it. And then we had to appeal to the school to allow me to leave campus for a month because you're
Right.
not supposed to do that.
Right.
And so with his help, I actually went to Bolivia for a month, and I went on a pediatric rotation. And I write about this a little bit in my book. I thought I was going to do pediatrics when I came into medical school. And the pediatric rotation down there was incredible because we were working with indigenous folks. We were also in the cities. We were in rural areas, and we were in orphanages. And so we just saw dozens and dozens and dozens of mostly mothers with their babies, and then usually 3, 4, 6, 10, 12 other children that they
Okay.
were bringing along with them. One of the stories I talk about in the book was being in a small sort of village hospital on the outskirts of the jungle in Bolivia, and there was an OB-GYN that I got to shadow down there for a week. And it wasn't easy to obtain birth control, and there were a lot of cultural barriers as well. This OB would allow women to arrive to the clinic. They would have purchased usually copper IUDs off of the black market. That's something you could do. And they would bring them in their purses. And he had the shades drawn. And with those patients, we didn't record anything. There were no names, there were no chart notes. And he would place these IUDs. And you would cut the strings really, really short so that potentially a husband wouldn't even know that their wife had had birth control placed. These were women who might have had 10 or 12 babies. And when you have that many children, oftentimes they had lost 1 or 2 children at the age of 6 or 7 or 8 years old because there just weren't resources if somebody got sick.
Right.
And so I did that rotation with him that week, and it dawned on me that the healthier a mother is and the more you're able to care for a mother, more likely the children in that family are going to be healthy as well. So that was my first sort of thought about pivoting towards women's health and OB-GYN. And then when we got into the clinical rotations, and I teach medical students clinically, and I always say to them, you have to love what you do in the day-to-day. So I realized I really like being in the OR. And if you don't like operating, and if surgery is not your thing, then OB-GYN is probably not the right specialty. There's ways that you can take care of women and even do labor and delivery without necessarily doing surgery, but I ended up really, really liking surgery. And so the combination of that, plus some rotations down in Salinas, California, where I delivered so many babies in a month, and I realized how much I really loved being on a labor floor. So that was really in the first few years of being here at Toro that led me to apply for OB-GYN residency, and that was unexpected when I first started.
Great. So you were talking about what the experiences that you had early at your time here at Turo that led you to become an OB-GYN. Was there anything else you wanted to share about that?
You know, I really do think that I got the education that I was hoping to by coming to an osteopathic medical school. You know, my path since then has been much more allopathic and traditional. And so I get to always sort of remember back to those years here working with the DOs on campus, our clinical faculty, that they were extremely invested in teaching us osteopathic medicine. The labs, and I don't know what has changed today, but to show up to a lab in medical school and we would strip down to sports bras and shorts and we would work on each other, and there was an opportunity to really work on each other as students as we were going through this very rigorous training process, and it almost felt like an added bonus. Most of the classmates that really invested in osteopathic medicine are extremely talented and like very sensitive when it comes to that kind of work. And so I was on the receiving end of that just as a student, both from my classmates as well as the faculty. And I have been able to carry that forward. I have colleagues who I refer patients to and who I am in very close contact with today. I have a very deep understanding of why that type of adjunctive medicine is extremely beneficial for patients, and it's something that can be overlooked. When it comes to OB-GYN, there's a lot that happens for folks in pregnancy, in childbirth, the postpartum times, the trauma, as well as babies that come out that could really benefit from osteopathy, and because I have a deep understanding of that, I'm able to at least offer that to my patients in a way that I would have never been able to offer if I wasn't familiar with the work.
Okay. Let's talk a little bit about your time in residency and then move into post-residency.
Okay.
So you went to Connecticut, you went back east.
I did.
Was that your first choice?
It was. I mean, I got lucky both with Turo and with the University of Connecticut. That ranking system and the match is quite a wild process, and we could spend hours talking about that. But I did, after interviewing at a lot of programs, I did end up ranking them first, and I ended up getting selected to go there. And I'm grateful for it. It was an extremely rigorous program.
How many years is it for OB?
It's 4 years.
4 years, okay. And then what happened after that? Where'd you go after that?
So I was in Connecticut. I had been in Boston, and then I came back here for medical school. Then I went back east. So I had this East Coast, West Coast thing happening. What happened to me in residency that was sort of unplanned and unexpected is I met my husband at the time, and I was pregnant before the end of my intern year. And that is usually not recommended, especially in OB-GYN, because back then we were still at the cusp of hours being a little bit more regulated, and so accreditation and things like that being tied to how many hours a resident can work had not quite yet been implemented. I was literally one of the remaining classes, and so we were working very, very long hours, and I had a baby in my second year. And so I was fortunate in that we made a decision for his dad to be able to stay home and really be the stay-at-home parent, and that allowed me to complete my training, which would have virtually been impossible, I think, without that, unless you have family, people that are really close by, which we
Right.
didn't have. So we're West Coasters, California and Portland, Oregon, and Alaska. And so I kind of knew at the end of training that I wanted to end up back on the West Coast. And I was able to find a practice. Oh my gosh, I'm so sorry.
It's
I
okay.
was supposed to be paused. I was able to find a practice in Portland, Oregon that sort of met what I was looking for, as well as a community that we were sort of looking for. So California felt like it might be challenging to move back to. There's just a lot of cost of living and things like that that we were taking into consideration at the time.
Right.
And so we ended up in Portland, and we've been there ever since. I'm in my 16th year.
Great. Okay, so that gives me a little frame of reference on time. So you've been there for 15, 16 years. Why don't you describe for us how you got from that time, your post-residence, you've got your first assignment.
Yeah.
You're back in Portland, ostensibly home, the
Right.
place you're going to make your home.
Yeah.
Not too many years after that, you came up with the mobile clinic idea. So why
Right.
don't you describe how you got from, I'm in Portland,
Right.
I'm practicing medicine,
Yeah.
now I'm buying an RV.
Right, yeah. I joined a small private practice, and at that time, again, I feel like I'm always kind of at the cusp of things changing, right? And so I grew up with a dad who was actually on faculty as a clinical professor here for many, many years, so people are familiar with him, an internist and an infectious disease doc. And he was very committed to his private practice and his small community hospital in San Pablo. And so I think I grew up with that as my idea of how to practice medicine. And so when I decided to take a job, at that time, there were just the beginnings of hospital-employed practices and clinics just being started. There was Kaiser, and then there were just a handful of sort of dinosaurs out there that still had these little private practices working out of community hospitals, and that was the practice I decided to join. So I joined that practice about 20 minutes east of Portland. They hired me after I sent them a resume, at the middle of my residency year. And I had that quintessential private OB-GYN clinic where I got to take care of all of my patients. I would go in and do my own deliveries. We were taking our patients for surgery. We implemented the robotic surgery program at my hospital. There was a doctor's lounge like the one I was used to at Doctor's Hospital here, where I knew everybody and really just had that family feel. I would bring my kids, who were really young at the time, to round with me on the weekends, and they would hang out at the nurses' station. So I got to have that kind of life that I had been hoping for. And it's very, very hard to sustain that. It's a lot of hours. There's a reason why it's changed. And we've implemented OB laborist models and hospitalist models, because to ask somebody to be on call, 24/7, 365, even for us, if it was every 3 nights or every third weekend, it adds up when you're also seeing patients in a clinic and you're a mother to young kids and you want to participate in their lives too.
Right.
And so I did it for 10 years. And towards the end of 10 years, I started daydreaming about, different ways to provide care. And it's interesting because my book came out recently, just a few weeks ago, and we're in a post-Dobbs world and in a time when reproductive health access, it really has taken a turn. Not for the better in a lot of states and in a lot of counties. But I started daydreaming about increasing access to care back in 2016, 2017. Like those of us that were in the sort of know could see what was going to happen in the pipeline. And I started imagining taking myself into other communities, because it's very, very difficult for a doctor to, sustain a practice in a rural community. There just aren't enough patients. We have the Oregon coast, and it's very, very difficult for specialists to survive out there, but there's a real need for specialty care. So even not just OB-GYN, but GI and urology and cardiovascular care, and you mostly have primary care in those communities, and even that is limited. So I took a little bit of time, and our family actually went to Spain for a year, and that was like a break from leaving my clinical practice and deciding what I was going to do next. And I was writing my book. And this was 2019, and again, unexpectedly, we got locked down in Spain in COVID.
Oh, no.
And so we didn't realize that our year abroad was going to include 55 days of our children not being allowed outside of the apartment, because in Europe, the rules were extremely strict. But it sort of was perfect for me because I had been envisioning mobile care. And then I got to experience what it was like in Europe, where when my daughter had a fever, I called a public health nurse, and they actually sent people to homes and apartments to check on kids and check temperatures and listen to heart and lungs and make a determination. And this was the first weeks of COVID. I mean, we were still learning how to do this, but that was something that was already a part of their public health process. And I started thinking about how I had imagined this RV that I could take anywhere in the US and pop open and see patients. And so when we got back in 2020, in that summer, I picked up a job as an OB hospitalist in Oregon, where I was traveling to different hospitals. I was one of the only people on an airplane, in a hotel, eating out of restaurants in that moment in time. But there was a real need for OBs in certain communities. And so I was providing that care. And in the background, I was sort of building the administrative things that needed to be done to potentially create this mobile clinic. So malpractice insurance, getting on insurance panels, figuring out medical legally how to do this. I started driving around my Mini Cooper and doing PCR testing for COVID on people's front porches, because I was allowed to do this sort of home care. I had gotten myself sort of credentialed to do that, but I didn't have the RV yet. And then that morphed into actually seeing patients in their homes for GYN care. And so there was this like post-COVID transition where I had a medical assistant, and we would just take a portable table into people's living rooms. I was placing IUDs. I was doing pelvic exams and pap smears. We were doing problem visits, just all out of the back of my Mini Cooper. And then that led into me getting the RV, and sort of the rest is what became FemForward Health.
Okay. So you bought an RV. The Mini Cooper wasn't enough at a certain point, right? And was that part of what led to the transition, or was that always the goal and you just hadn't gotten there yet?
Yeah, it was always the goal. I mean, it's not really cost effective to drive from home to home. So people that do home care know there's a limited number of places that you can be in one day if you're driving from location to location. So my idea was, what if we were able to park somewhere that was a little bit central for a neighborhood or a community, a place where maybe people could walk there, or I had patients in my private practice that could not afford the gas money, or maybe couldn't even afford the bus, fare to get to the clinic. So how do we get closer in, but not necessarily to their front doors? And so that was the idea for the RV. I had never really been in an RV. Like, I had been a tent camper. And so when I started imagining an RV and I actually walked into one, I was blown away. I was like, this is amazing. We have a sink and running water, and we have a toilet, and then there's this back room, and there's a front entrance. It really just felt like just the right amount of space to have a little clinic and see patients. And so that's what led to me walking into camping world and financing this 31-foot RV that we ended up very DIY with friends, turning it into a clinic. So I had a friend who's a seamstress who built all the curtains, and I had other people help me rip the bed out of the back. We turned that into a little exam room. And the front is basically what it has always looked like. My patients come and they sit on the couch, and I sit on a stool facing them, and that's where we start our appointments, one person at a time.
That's great. That was 2022-ish?
Yeah, 2022.
Okay. How many miles on that RV?
It's interesting. It's not a high mileage. We're probably only at about 40,000.
Okay.
But we have stayed in Portland, in the greater Portland area, with some occasional excursions that have taken us a couple hours out of the city. The model is to have a home base, someplace where doctors can live and work, and then sort of spoke themselves out to other communities. And I think within 90 minutes is sort of reasonable to ask somebody to drive, unless you really can stay overnight somewhere, because it's not just me. I also have a medical assistant, and people have families.
Right.
So how do you do this sort of spoken wheel model where you can live somewhere that's sustainable for you and a family, and then get out into more rural areas? And so that's kind of what we do now. I mean, we have been out to the Oregon coast. We parked on a pier, and I was inside just, placing IUDs while other people were on the pier eating cotton candy, and, the bubble guy was doing the bubbles. And there's something that's kind of delicious about doing something in a way that, maybe the outside world doesn't really know what's happening, but within the walls, it feels like something sort of magical. And that's what it feels like, especially when we park on private properties. We park in front of barns. Sometimes there's a yard sale happening next door. And one at a time, we're just performing like very high level OB-GYN care inside of the RV.
That's wonderful. Your patients, they obviously like the opportunity to see you in that fashion, or else they wouldn't come, right? What kind of feedback are you getting?
I mean, that has also just been tremendous. I mean, when I started the clinic, I didn't know what I was doing, and I always just say, I probably benefit from that little risk-taking, adventure-seeking side of myself, where I don't have to know how things are going to go in order to start. And I think anytime you're going to do something a little bit outside the box, it probably requires that. I had, people question who's going to want to come and see their gynecologist inside of an RV. It's already a vulnerable experience. And now you're in a parking lot, who's going to do that? So we benefited from a few things. One is that I had been in the community for over a decade. So we had patients who said, we would see you in a garage. We would see you anywhere. They trusted me. They knew my staff. And so they were very open to the idea.
Well, that's great.
And little by little, and I really, truly believe this, is if you build something aspirational, you are going to attract aspirational people. And from day one, I really believed, especially, we started this before the Dobbs decision, but then after Dobbs came out, I really felt like people want to be a part of something that's larger than themselves. They don't want to feel like they're just in it for themselves. And how can we do something that's going to possibly invoke greater change? And so this clinic for me was an opportunity for people to come and become our patients. And every new patient that comes in, I ask them, how did you hear about us? And I will just tell you, we haven't had the money to do marketing. We are not marketing ourselves. So this was organically grown. And I have just this incredible patient population who they've heard about us through the Google reviews. They found us through their insurance carrier, and then they looked us up. And they see our website, they read what our mission is, They see that other patients have had this experience. And I'm really sorry to report that the current healthcare system isn't really working for a lot of people. Not for the patients, and also not for the doctors and the other providers. And so to have the opportunity to participate in something that people are describing as joyful and safe and inclusive, that is what has been driving our growth. And so we are busy. We have a full panel of patients. They're from everywhere. I mean, you wouldn't believe the types of patients that I see inside of an RV. Now it's like an inside joke. Like, this person actually came and saw me inside of an RV, and you may not have expected that, but she's sitting right there on the couch with me.
Yeah, so you still, I mean, you've got this wonderful outreach going on, but you still have one foot in what may be described as traditional medicine,
Yeah.
correct? Why don't you describe what that role is?
Yeah, when I got back from Spain, and I knew I was going to start a private clinic, I needed a job and I needed to continue to keep my skills up in order to do that. So as a surgeon and as somebody who does obstetrics, you need to make sure that you're like constantly keeping up your skills. You don't want to go years without performing surgeries or doing deliveries. So I became an OB hospitalist. And I was actually able to go back to my original home hospital where I had
Nice.
started back in 2010. And since then, I was doing hospitalist work, and then I was also able to move into a leadership position there. So I am a director of the Family Birth Center at our hospital. And it's a really, like, I was on 2 meetings this morning, and these are hospital meetings. And what we're doing is we're looking at more system level quality and safety in women's health. So, like, how do we provide better care for women on a system level? And how do we coordinate with other hospitals? What do we do about shortages? What do we do when somebody comes in the middle of the night and you might be a low level of care hospital and they have to get transferred to a higher level of care? So what's been really amazing for me is that even though I'm in an RV a few days a week, practicing what I consider like idyllic and idealized medicine, I am very much entrenched with what is happening in the world today and in the country today. And so I get to kind of do best of both worlds with that. I really like being a part of hospital leadership. I mean, it helps you understand the choices that are being made, because in order to keep hospital doors open, you have to make decisions about, bottom line and things like that that we don't really want to have to think about as physicians, but unfortunately, that is the way that healthcare is run in this country. So no matter what your opinion is on it, like, it is the reality that we have to work within. And so I'm there also trying to see, like, well, how can we make this better too? Because the majority of people in this country, they're going to step foot into an emergency room or onto a labor and delivery unit, and we want to show up for them.
Yeah. So you were talking about how you've got your feet in both worlds right now. Have there been any conflicts between those two worlds, or are they symbiotic?
I would say they're pretty symbiotic. I don't really talk about my clinic when I'm doing my hospital work. There's just an understanding that, I'm a private practitioner in the outside world, but I do work for a hospital system. And so when I'm within the hospital system, I'm really like working for the system and promoting that. The benefit that I have is I know everybody in Portland, and I know every specialist, and I know all the hospitals. It's a great resource for my patients because I can pick up the phone and call almost anybody in Portland if my patients need something. I also have maintained my surgical privileges at the hospital, and so I'm able to take my FemForward Health patients for surgery at the hospital, and so it allows like this kind of seamless, back and forth for me. I do think it helps to have credibility both in the hospital system as well in Portland to have this clinic that's in an RV. I think it might have been harder to get it off the ground if I was somebody that nobody had ever heard of and that I just like showed up in the community. And I will just say that is something that I'm learning, and I've learned from building the clinic, is that relationships with the community and starting from there is actually what sort of helps gain trust. And it's going to be what helps, other providers. As a specialist, you have to get referrals from other providers. And so in order for me as an OB-GYN in a clinic to get referrals from the primary care doc community. And I have a lot of therapists who refer their patients to us now because we provide trauma-informed care, and the word has got out about that. You have to have some credibility. So I'm just going to say I had that behind me. I'd been in the community for a decade. I'd had my own practice, and I worked in the hospital. So I guess that's my one word of advice for other people. I mean, I encourage everybody to sort of dream their little dream, and how do you create something in your corner of the world. But it really helps to start where you are and where people know you. So I think if I had decided I was just going to blow this up and go into other states that really have a true shortage of OB-GYNs, I don't know if that would have worked out as well, although that possibility is still there in the future for us now. We have a real model that is working, and so can we expand that? I mean, I hope so.
Okay, great. Now, also a published author, so congratulations. You mentioned earlier that you were working on the book before Spain.
Yeah.
In the lockdown, and obviously I'm sure you had time during the lockdown to work on the book because you were locked down. What was the impetus to even write a book? Like, you just wake up one day and say, I'm going to write a book about everything I've seen?
I mean, definitely not. I didn't know that I was writing a book, so I've always been a writer, and going back to what we talked about earlier, even at UC Davis, I was a writer in elementary school and in high school, and then in my master's program we did a lot of writing, and so I always knew that was something that I was going to hopefully come back to. Medical school and residency and then having children took a lot out of me. And what happened is when my daughter started sleeping through the night, I decided I was going to start taking writing classes again. And it had probably been 15 or 20 years since I'd actually seriously written anything. And so I signed up for classes, and then those turned into weekly groups where you'd have an instructor and a group of people that were working on pieces, and we would share. It helps to have accountability when you're writing. I say that I wrote this book in the cracks of my life like the breath between labor contractions. And the truth is, I wrote this book between 6 and 7 a.m. in the morning. And I would get out of bed and I would go to the coffee shop down the street, and I had a table in the back room, and I would sit there pretty much every day between 6 and 7 a.m. And that was before the kids woke up and before I had to start my day. There were times when I came off a 24-hour call and I would just go straight to the coffee shop and I would write for an hour before I went home. So there was a drive in me to write, and then there was a drive in me to tell certain stories. And ultimately that turned into this book. But it took about a decade.
Okay. And now it's published. You said about 3 weeks ago.
Yeah.
Became available, and you're doing you had your launch in Portland. Just
Yes.
tell us a little bit about that. How fun was that?
Oh, it was such a blast. I mean, for people that write, there's sort of writers' dreams about having your book, first of all, get published, which that's a whole other podcast, is how do you get a book published? And now I'm an expert in that. But to have a true book launch at an iconic bookstore is something that we sort of dream about. And I got to launch my book at the downtown Powell's bookstore, which is one of the largest independent bookstores in the world. And you sort of feel like you made it if you launch your book there. They have a marquee out the front, and your name gets put up on the marquee for the week. And I had actually one of my best friends from Toro actually flew out to be there with me from Colorado. I had brothers and sister-in-laws and nieces and nephews that actually flew into town. And I was sitting in the back, and you never really know how many people are going to show up to your book launch. So I was back there, and I had a friend text me and say, they're putting out extra chairs. And so we had a huge turnout. We had probably over 110 people come. And when I stepped out and I saw all the people, I mean, it was the nurses and the doctors from, 15 years of being in Portland, my best friends, family members, and patients that had shown up. And so to sit and to be able to talk about this work that is not just about me, I mean, this is our work. I dedicated this book to my grandmothers and also to OB-GYNs. And so to be able to share our stories, and I'm now being given somewhat of a platform where I get to talk about what it is to be an OB-GYN in America today, which is not easy. It feels like a real privilege and something that I didn't even plan on.
So we've got, obviously, we're still a full-on medical school here. We've got students that are first years that are just finishing up their first year now and taking their finals. You may have heard them passing classes in the background. Our audience may have heard them in the background a few minutes ago. Second years have finished their finals and are studying for a board that they have to take and getting ready to go off on residencies. We had match day like 3 weeks ago with everybody else on match day. So there's all kinds of excitement on campus for the students that are getting ready to go off on rotations. And then we have the students that are off on rotations as well. What advice would you give to current students, first and second years, as they prepare for rotations and trying to decide what they're going to do with their lives?
You know, I was a reluctant medical student, and I was thinking about this driving in today, how many people told me that I was never going to make it in medicine. And part of it is that I had these other things that I loved to do, and part of it is that I had to work really, really hard to do well in biochemistry and in organic chemistry, and that continued here at Toro. You know, it's not like those subjects came super easy to me. So number one is to make sure that you build a community and don't do it in isolation. I came to campus every single day. And I'm not saying that you have to do that, but I know that there are options to not be on campus. But I had a group of friends that became my study partners, and we were here together almost every day. And so I do think that having that in-person community, and you know, COVID and lots of things have changed that for us, but it made a real difference, because it's not just about the classwork, it's about what happens in between class. And it's about what happens at the end of the day, and it's where you go to eat, and where you're going to study later, and where you're going to go work out together. And so I think trying to make sure that you have your people while you're here the first 2 years, because you do get scattered in those second 2 years, and you sort of lose touch of that. And it was hard to lose my community. I mean, we're still in touch today. I mean, there's still a cohort of us that are still in contact. But those first 2 years can be magical, like if you decide to really do it with other people. So that would be my first advice on campus. Studying with other people, just knowing that this does not have to be a solitary process. And then for clinical rotations, I was one of those people that just loved every rotation. I mean, I was like, orthopedic surgery? Yes. And I mean, that's the last thing that I would have ever expected. I mean, I loved cardiology. The ER was amazing. And so I think if you go into your clinical rotations, like sort of with this open-mindedness and this understanding that you're getting this behind-the-scenes peek into a world that nobody else gets to have. And if you are never in an orthopedic surgery case ever again, it's fine, but to spend 1 month really like relishing in that world without the burden of responsibility for the patient on you, like you get to be there and you get to hold those instruments or get to ask those questions. I don't know, I was just very enthusiastic, I'm gonna say, about every rotation that I entered. I think I just went into it like just telling myself that this is kind of like once in a lifetime, and you know, it's only gonna get more serious from here. Third and fourth year are fun. I mean, it's a lot, and you're traveling. I was sleeping on couches, and you know, I was all over the country in some ways to get those rotations in. But I will say that make friends with the clinical staff. Always make friends with the nurses. Like, be the nurses, you know, number one person. Like, ask them how you can help, and you will get like basically shepherded through not just your clinical rotations, but once you get into residency, that's what was taught to me. And you know, 15, 16 years now into my career, it's the nurses who really have my back and I have their back, and it's what makes this career like such a fun, rewarding career, because you're all in it together. And so I think, yeah, community for me is everything.
So we're about at the end of our time. Dr. Afsari, I want to thank you for joining us here on campus in our new Community Engagement Resource Center on the third floor of the renovated Truett Hall. And I hope you enjoy your tour later today of the campus. I want to thank our audience for joining us today. Until next time, everyone, take care.
Thank you.